I'm Carol Hind, I'm a Deputy Assistant on Ward 25, the Paediatric ward, and I am the lead on our surgical steering group. So I formed the group to try and improve the surgical pathway for children and their families, and also make things a bit easier on the ward as well. We saw some areas of improvement. I approached our matron who said, yep, get a team and run with it. So we did that, and we used different members of the team from play specialists, healthcare, nurses, and we involve anyone we need to involve to work across all levels and divisions to get our projects up and running. So some things sounded really simple, but it was things like in the morning every anaesthetist was doing their own different pre-medication doses, which was providing some confusion for the staff who were a bit reluctant to give doses they weren't familiar with. So we worked with the lead paediatric anaesthetist and came up with a set pre-medication dose, and we standardised it. That was then filtered down through the anaesthetists, and that eliminated the problem. Every child has a set dose based on their age. Mornings could also be a little bit chaotic. A lot of admissions, the normal inpatients were in, the theatres were coming in, there was different surgical teams, different anaesthetists. It was all a bit chaotic, so we set up a surgical admissions unit. So now in the morning all our admissions go to one separate area, which in an afternoon is our child assessment unit, and the anaesthetists and surgeons all know to go to that one place, and that's where everyone's filtered to in the morning, and it cuts down a lot of the hustle and bustle and noise and chaos in the morning on the ward. Then to try and improve the patient experience and pathway, we managed to source some electric cars. That took a lot of cross-divisional working between theatres, porters, and also health and safety, getting risk assessments. So we have cars now that children of different ages can drive themselves to theatre, and they love it, and it really helps relax them. It's fun, and porters are very kind and bring the cars back for us once we've taken the patients to theatre. We also got patient bleeps. We were finding a lot of delays. Theatres would be ringing saying we're ready for parents, but the ward was sometimes so busy we were delayed getting them down, and then the child would be upset by the time we got there. Parents would be anxious because they want to get to the child. Whereas now, anyone who goes to day case theatres gets a bleep and a little map to find their way, and the theatre recovery staff bleep the parent directly, and they follow their map and go straight back to their child, and it cuts us out as the middleman and prevents any delays. I think the biggest thing has been patient experience, and we get lots of positive feedback from the changes we've made. The cars particularly make a massive difference for children who are nervous and anxious about going to theatre, and it makes it fun for them and distracts them a little bit, and then that also helps the parents relax because the children are relaxed. Again, the bleeps, patient experience, even the surgical assessment unit in the morning, it's not just patient experience, it's the staff. It's made life a lot easier for the staff, and it's simplified things a lot for us. So overall, the work we're doing is making massive differences on the ward, not just to the families but to the staff as well.